This is an example of a colon that is affected by Crohn disease. For orientation, this is the rectal end of the specimen, and this is the cecal end of the colon. Crohn disease, which with ulcerative colitis comprises inflammatory bowel disease, is due to inappropriate mucosal immune activation leading to a chronic inflammatory condition. Inflammatory bowel disease commonly affects women in the teenage years or early 20s. Crohn disease, unlike ulcerative colitis, may occur anywhere along the GI tract, but most commonly involves the terminal ileum, ileocecal valve, and cecum. Unlike ulcerative colitis, skip lesions may occur. These appear as areas of normal mucosa interspersed between areas of active disease. Here is an example where you can see active disease with pseudopolyp formation, an area of relatively normal colonic mucosa, followed by a third area with pseudopolyps and ulceration. Typically, there is transmural involvement with a thickened bowel wall, strictures, and fistulae. Strictures are areas where the scarring has narrowed the intestinal lumen. Fistulae are abnormal connections between two epithelialized surfaces. There are no fistulae here, but we do have a stricture. You can see this area here, where the bowel wall has become thickened and scarred. As I reapproximate the cut edges of the colon, you can see the narrowing of the lumen. The patchy distribution results in a coarsely textured cobblestone appearance of the mucosa, with the affected mucosa depressed below the surface of the normal tissue. There may be creeping fat in which mesentery extends around the serosal surface, which you can see here. The fat is no longer hanging normally from the colon, but instead really wraps around the serosa. Microscopic features of Crohn disease include neutrophil infiltration and damage to the crypt epithelium, crypt abscesses, loss of normal crypt architecture, and granulomas. This specimen displays skip lesions, a thickened bowel wall, an area of distinct stricture formation, as well as a cobblestone appearance of the affected mucosa and pseudopolyps. Patients with Crohn disease are at increased risk for developing colon cancer.